Hey guys, ECRG here, back with another episode. The title of this episode is The Timing and Luck of Clinical Research Jobs. And I wanted to make this episode for you guys out there. There's a lot of people that email me on a daily basis that are trying to get into the clinical research industry. And I probably haven't made it clear enough, or I don't think it's clear enough at all out there, is that there is a timing and luck factor. A significant factor of it is timing and luck when it comes to getting your foot in the door in the clinical research industry. Now, before I expand a little bit further, I just want to let you guys know about the resume review program we've got going on and interview preparation. So if you are having a hard time getting into the clinical research industry, you can email me at eliteclinicalgroup@gmail.com. If your resume sucks, you've applied to hundreds of jobs, lots of jobs, and you're getting no traction, email me there. I'll get you right. eliteclinicalgroup@gmail.com. So back to the episode, the timing and luck. There's a huge timing with clinical research. There's timing in everything, but especially with clinical research. One, because of the actual time of the year that you're applying. Are you applying in December? Well, guess what? Everyone's out on vacation during December. Everyone's out on Christmas leave and then New Year's. And people are just now getting back into the swing of things in January. Or end of January. So, could it be bad timing on your part? Are you applying during a lull? Are you applying when there's no jobs? Are you applying right after a merger and acquisition of a major company? During those times, companies put a freeze on hiring when they're buying companies or buying a big company or trying to merge with another big company. There's a freeze on hiring a lot of times, so you're not going to be able to get a job there. So timing of applying is very, very important. That's why I just suggest to keep applying, stay on the offense, stay aggressive, so you don't have to worry about that. You don't have to worry about all these nuances with applying and stuff. Apply to hundreds of jobs. Keep applying, stay on the offense. You'll eventually get your shot. But there's also a luck. The right person has to look at your resume. Sometimes it could be someone that went to your alma mater and they're like, okay, I like this person. How lucky is that? Whatever it is, maybe that person was a nurse and you were a nurse too. They worked at the same hospital and there's that connection. It just depends. There's so much that depends. It could have been some other person that was reviewing your resume, but that person was sick that one day. So this other person was reviewing your resume and they liked you. So there's a luck about it. But each time you apply, you're giving yourself another at-bat. You're giving yourself another chance to get into the industry. So that's another reason why you've got to make sure that you're applying, and keep at it. Keep the pressure up. Do not give up after that first month. After you get all rejections. Do not give up after that second month when you get all rejections and a few times they've locked your resume. Do not give up after that third month when you've gotten one call back but didn't lead to anything. Do not give up after that fourth month when you've gotten an interview but you didn't get the job. All right? You've got to keep at it, guys. Keep at it. A lot of it is timing and luck. Half the time they put positions out there for people to apply for, but they've already got an internal candidate that they're ready to put in the position. So you might get an email a week later saying that you didn't get the job when they never reached out to you, they never called you, just an automated message. It happens all the time. So that's why you've got to continue to apply and continue to give yourself as many chances as possible to get into the industry. The timing and luck of clinical research is very, very important. I was talking to a colleague of mine a while ago about this very, very concept. And, there were situations in that person's, career path where just straight up luck, they were trying to be a CRA and it just so happened that the right CRA left and they opened up an entry-level CRA spot and no one else was really trying to go for it. A lot of it are people in your cohort, in your circle at work trying to do the same thing as you. So there was no competition for it. And this person was able to get that job. It's just timing and luck and giving yourself a lot of opportunities. I was very fortunate in my early on. I was a contractor first, but then later on, they had some openings to get in full time. And I was very fortunate to interview for the job and get the job. I don't know how that happened. They could have easily chosen someone else. Other people were very, very qualified. But sometimes it's luck and sometimes it's timing. Maybe no one else was really serious about that job, but I was serious. So it just depends, guys. Don't take rejections too personally, because a lot of times, they just have to go with someone else. Sometimes it's the boss's daughter. Sometimes it's, the CEO's friend. Don't take it so personally. Sometimes other people have to get the job for whatever reason. Other times they already got someone that they thought about for the position already. And then sometimes, on a not even timing and luck situation, your resume is bad. Your interview was bad and you didn't get the position. So there's all these different things that go into it. Timing and luck is a huge thing. It's a huge deal when it comes to getting into clinical research. So keep that in mind. I've done episodes on the past where I've talked about the best times of the year to apply for clinical research. Well, the best time is really all the time, but there's some pockets throughout the year where clinical research tends to slow down. And one of those is after October 31st, right after Halloween. Because you've got Thanksgiving in November, you've got Christmas in December. Things get really, really slow. And that's the end of the year. People are trying to make sure that they meet their budgets, their metrics, etc. So they're not really worried about hiring someone new. There are some other podcasts throughout the year. You can go check that video where I talked about that if you're on YouTube or on the podcast also. But guys, don't take it too personally. So that's it for today. Email me, eliteclinicalgroup@gmail.com. Take care, guys.